Good morning, everyone. My name is Patricia Mueller, and I'm the Chief Executive Officer of Homes First. We are pleased to be presenting this press conference here today at the very first building in the City of Toronto for single homeless adults. The building was built in 1984 with the support of people that worked for many different agencies in the City of Toronto, trying to get people into rooming houses, and the people were told if they don't have a diagnosis, they don't qualify. If they're haven't gone through rehab, they don't qualify. And these individuals said, couldn't we just get people a homes first? And so that was our name. And along the line, we've often seen people that wanted to stay here all of their life. And we are really, really excited because we know how important it is to have a home, to have a key, to be able to get involved. And so therefore, we also know that people don't want to die in hospital. They want to die at home. And we also know that this is a very prominent neighborhood for people that may have been marginalized. So we're thrilled to be able to support people in decline, to support people to stay in their community when they become palliative. So we're really, really thrilled. And so with that, I would like to welcome the minister. And Dr. Eric Hoskins, as you all know, was first elected to the Ontario Legislature as MPP for St. Paul's in 2009. It's enough? I think they know your bio, but thank you very much for honoring us today.
Well, good morning, everyone, and thank you, Patricia. I'm glad we cut short that intro. This is, it's my honor to be here this morning. In fact, this is such an important and meaningful announcement. And I want to thank you and your entire team at Homes First for hosting us here today. I wasn't aware of the history of this building and the clientele, which is really fascinating, and so it's deeply appropriate that we have this announcement at this location. And thanks to all of you and even a few folks that are still in the corridor, thanks for joining us here this morning. I want to start by acknowledging some of the incredible leaders and advocates who are here today and work tirelessly to help some of the most vulnerable, underserved populations in this city and indeed across Ontario. We're joined by Dr. Nahid Dasani, who is here with Inner City Health Associates, truly a champion for homeless people, particularly homeless approaching or at the end of their lives. And we also are joined, we're fortunate to have Nancy Lefebvre here as well, who's the Senior Vice President of St. Elizabeth Healthcare, which is Canada's largest social enterprise. We're joined by Dina Mall, who is CEO of Toronto Hospice. And Toronto Hospice has provided compassionate end-of-life care to almost 12,000 clients and their families in their homes across this city. And Rick Firth from Hospice Palliative Care Ontario, an incredible advocate for advancing and increasing access to hospice palliative care in this province. We have the Toronto Central Inn, always an essential partner in all great Toronto health initiatives, and of course, Homes First Society. Ladies and gentlemen, the people at these organizations are finding innovative approaches to solving a complex challenge. And it's thanks to their goodwill and their ingenuity and their commitment to public service that we are here today. And although he couldn't be here today, I also want to acknowledge John Fraser, who is my parliamentary assistant in the Ministry of Health, who has been leading the palliative care file for this government. And thanks to his efforts, we've made a lot of progress very quickly, necessary progress. So we're very lucky to have his insights and knowledge and commitment as we work to expand access to hospice palliative care across this province and make sure that it's available for everyone, including some of the most vulnerable people in our society who often fall through the cracks. Well, it was 2 years ago, not far from here at Yonge and Dundas, a homeless man was found dead after spending the night outside in frigid temperatures wearing little more than a shirt and a pair of jeans. One can only imagine it's an absolutely horrible way to spend your last night on this earth. A number of homeless people died from sleeping out in cold that winter back in 2015. You recall it was a particularly cold winter. And this one is expected, I think we all believe, that it is expected to be just as bad. And as we approach the holiday season, while most people look forward to celebrating and spending time with their loved ones, hearing stories like this, stories of loneliness, of pain, of suffering, it's particularly heartbreaking. It makes you wonder, if we as a society have so much, how can it be that there are people in our own communities who are forced to face a death that is so stripped of dignity? Now, as a relentless optimist and someone who has witnessed unbelievable acts of selflessness and perseverance, I know we can do better. And you know that we can and will do better. Today, we're surrounded by people who live this reality every single day and who never stop striving to ensure that some of the most vulnerable people in our communities don't have to face their final moments alone, in pain or in fear. And that's what the hospice palliative care community does. It's a community that quite literally built itself from the ground up with countless hours, I think probably more than anything else in the healthcare sector, countless hours put in from volunteers and people who believe in the power of the community, of helping our fellow man or woman live well until their very last breath. It's a community of people tremendously dedicated to building a fair society. And here in Canada, our belief in universal health care has become one of our defining characteristics. And I'm sure you would all agree with me when I say that every person, no matter who you are or how much money you have in your wallet, you still deserve to have access to the same high-quality care, no matter who you are or where you live or what the circumstances. But we also know that we are living in challenging times, where despite many people doing well, it's easy for others to fall through the cracks. So as government, our job is to take on those challenges, those gaps, so that everyone, no matter your income, your ethnicity, or your family history, everyone has the same chance to live a fulfilling, healthy life. And a strong healthcare system can play a big role in creating that fair and equal playing field. As Minister of Health, striving for equity has always been a guiding principle behind every decision that I make. That is the role and should be and must be the goal of government and everything that government does. But we still have a long way to go. Those gaps still exist, and there are a lot of people this holiday season who are just trying to get by. So, to bring us a little closer to home, I've come here today to announce that the Ontario government is partnering with Hospice Toronto, St. Elizabeth Healthcare, and Inner City Health Associates to open a new 4-bed hospice called Journey Home to support the homeless population of the downtown core here in Toronto. And over the next 2 years, 6 more hospice beds will open in this city to serve the homeless population. So folks, these 10 new beds are going to help roughly 80 individuals each year who are homeless or in vulnerable housing, to help them have a safe, comfortable place to lay their heads in the final chapter of their lives. They will be supported with care, we know, because when we look at the strength of the partners involved, these individuals will be supported with care that is high quality, compassionate, and suits their unique needs. You know, we know that there is no chronic disease, no other health condition that impacts life expectancy as severely as homelessness does. That's an incredible statement and sentence when you think about it. No other chronic disease, No other health condition impacts life expectancy as much as homelessness does. In fact, here in Toronto, at least 70 homeless people died in the first 9 months of this year alone. And tragically, the median age of those who died was just 48. Lives cut far too short. Now, especially at this time of year, as the city dips down to freezing temperatures around the holiday season and after, we are pointedly reminded of the challenging realities facing some of the most vulnerable people in our communities. And those realities exist beyond the downtown core here in Toronto. We know that homelessness is something that people are experiencing across the province. So I'm also pleased to announce today that our government this year is investing an additional $1.1 million to support local efforts province-wide to improve access to hospice palliative care for people who are homeless. You'll know that our government has set an ambitious goal to end chronic homelessness by 2025. We have a tremendous amount of work to get there. And we can only work towards achieving that goal by taking the lead from partners like the ones that are here with us today, who are truly at the front lines. You have the skills, the knowledge, and the innovative ideas to make a difference in the lives of some of the most vulnerable, marginalized people in this province. So I look forward to continuing to work with you to put your great ideas to work. Thank you very much. Thank you, everybody.
Thank you very much, Minister. I'd now like to call on Dr. Naheed Dassani to say a few words, and he is with the Inner City Health Team, and I don't know if you would like me to share your whole biography with the group? Okay. Don't want to be cut off.
Thank you, Patricia, and good morning, everyone. Most Canadians want to die at home, but where do you go to die when you have no place to call home? Terry was a 32-year-old homeless gentleman whom I met during my residency training. After being diagnosed with a widespread head and neck cancer that disfigured him, Terry began to isolate himself due to feelings of sadness, anger, and frustration. His long-standing chronic mental illness, schizophrenia, and substance use often made it difficult to attend appointments and adhere to care plans. Unfortunately, this was no different when he was diagnosed with life-limiting cancer. So he did what anyone would do as he started to experience pain. He went hospital to hospital, ER to ER, walk-in clinic to walk-in clinic, trying to seek the kind of pain control that any Ontarian should really have access to. Unfortunately, for a variety of reasons that are being discussed today, Terry was not able to access the medicines he needed to actually appreciate a good quality of life. Unfortunately, his pain perpetuated him into a cycle of anger, sadness, and anguish. Terry ended up dying due to an overdose from alcohol and street drugs, maybe as a way to seek pain relief both physically and emotionally. This traumatic and tear-gripping story rocked my world as a health provider, displaying the complex needs of our society's most vulnerable. At any given time, there are more than 5,000 unique individuals experiencing homelessness in the city of Toronto, living in the streets and in shelters. But for every one homeless person we see in the city, there are also 23 others who are vulnerably housed, who are just as sick. Sadly, every year, many people like Terry die in isolation with few supports around them. People who are homeless carry a higher rate and burden of illness. About 75% have at least one or more chronic diseases, and life expectancies range from 34 to 47 years old. In addition, there's more trauma, discrimination, social isolation, mental health concerns, and barriers in accessing mainstream health services. Being sick, of course, is very hard, but being sick and living and dying in a shelter or on the street or in a crowded rooming house is even harder. Journey Home Hospice will provide a warm and welcoming place for people like Terry to spend their last days and weeks of life. A place where they can receive high-quality, compassionate care that is tailored to their needs. A place that is welcoming to their street family and friends, and where health professionals and volunteers have specialized training in harm reduction approaches and complex mental health and addictions issues. As a center for excellence for best practice for homeless and end-of-life care, Journey Home Hospice will accept and meet people where they are at, offering people like Terry a better life and perhaps a better end-of-life journey in a home-like setting and a more suitable place to die. Thank you. I would now like to introduce Nancy Lefebvre, Senior Vice President and Chief Clinical Executive at St. Elizabeth, who will be speaking on behalf of the partner organizations that are making this vision a reality.
Thank you, Naheed, and you can see that Naheed has no shortage of passion for what it is that he's doing, and I thank you for that. Passion is certainly a common thread through all organizations behind Journey Home Hospice, Inner-City Health Associates, Toronto Hospice, and St. Elizabeth. And when we first came together to embark on this project, we knew we were taking on a very big challenge, tackling not just one, but two tough societal issues that are often avoided: homelessness and death and dying. But after working with the team for the past 12 months, I honestly can't imagine a group of people who are more fit for this challenge. We each bring a unique perspective, specialized knowledge, and expertise in the many facets of launching, operating, and sustaining a hospice for the homeless. I'd like to recognize my counterparts, Dina Mall, Executive Director of Hospice Toronto, Dr. Leslie Shanks, the Medical Director of Inner-City Health Associates, for their leadership, collaboration, and tireless commitment in bringing Journey Home Hospice to life. I'd also like to thank and acknowledge Patricia Mueller, thank you, CEO of Homes First, who has been a wonderful partner, coming to the table, providing space for our four-bed hospice, and of course for hosting us today. Finally, Shirley Sharkey, the CEO of St. Elizabeth, who has been a key champion for this project. Within our organizations, we are certainly fortunate to have an incredible team of leaders, physicians, allied health professionals, and staff. We have established a community advisory panel also to help guide our work. As I said, passion runs deep, and when people rally around a common vision, it's amazing what can happen. On that note, we'd like to thank Minister Hoskins for your support, Parliamentary Assistant John Fraser, who's been incredibly supportive to the whole hospice movement, the Ontario government, and the Toronto Central Local Health Integrated Network, who's represented by Rose Cook here today. Thank you, Rose, for investing in our hospice and your strong support. And also Rick Firth, the Executive Director or CEO of Hospice Palliative Care Ontario, for without your support, we wouldn't be here as well. We will also be inviting public and corporate and community partners to join us on this journey for Journey Home Hospice with our official launch, which will take place for the larger hospice in 2018. But I thank you all for coming and for joining us today on this really super exciting day. Thank you.